Good morning. I'm Chris Magnus. I'm the police chief of the Tucson Police Department. And I wanted to talk to you this morning because I am really deeply saddened, but I'm also frustrated and angry about the death of a young person in our community. We're in the midst of a crisis, and we need to do more. So just to set the stage a little bit, we're in the early part of an investigation that involves the death of an individual who overdosed yesterday afternoon. And because this is an active investigation, obviously, there are some aspects of this case that I'm not going to be able to share with you right now. But let me tell you a little bit about what we know at this point. Our Southside TPD officers were flagged down in the area of Park and Ajo about a drug overdose situation that involved multiple individuals. The witnesses who contacted the officers were in the midst of transporting one of the overdose victims to the hospital. This 20-year-old male victim was unconscious and he needed immediate medical attention. Our officers, as a result of the training that we provided them, immediately recognized that this was likely an opioid-involved overdose, and they requested assistance right away from the Tucson Fire Department. While waiting for TFD, the officers used an opioid reversal drug, naloxone, to reverse the effects of these likely opioids. All our patrol officers have been issued, and they carry naloxone. And this is something that can be administered nasally. This is what it looks like. This is what our officers carry. It opens easily. It is commercially available, very simple to use, and it's life-saving drug. The witnesses told our officers that there were other overdose victims in need of immediate medical attention at a residence in the 800 block of West Idaho Street. Our patrol officers responded code 3, and at the residence, they discovered 6 more potential opioid overdose victims. As the officers searched the residence for the victims, they began to administer naloxone in an attempt to revive several of the victims who were in a medical crisis. TFD responded to the home and transported several individuals to various hospitals for treatment. And I should say these were all basically young people in their late teens, very early 20s. While 4 of the overdose victims are recovering, very likely a result of our officers administering naloxone, I'm deeply saddened to report that a 19-year-old male, Aaron Francisco Chavez, did not survive. Now, at this time, we can't definitively say what drugs these victims ingested or were exposed to, but we suspect that whatever drug or drugs they took were probably counterfeit and contained fentanyl or a combination of multiple high-potency synthetic opioids. Now, there's some key points that I'd like to make that help, I think, prevent this from being an even greater tragedy. And these are things the public really needs to know and understand. First of all, the willingness of people in the car to flag down officers helps save lives. For those who don't know, recent changes to Arizona's Good Samaritan law for drug-related overdose has made it so members of the community no longer have to fear prosecution for reporting overdoses, such as the one that occurred yesterday afternoon. Also, Tucson Police, as I mentioned before, are all issued and trained to use the drug naloxone in overdose situations. Even if it's not an opioid, by the way, the drug naloxone will not have a detrimental effect on anybody that it's used upon. In other words, it could be used if you suspect any kind of overdose, and it's not going to have a harmful impact on the individual. And so in this case, we know that the officers who used this drug very likely contributed to saving several lives. But we've got a problem. Not every law enforcement agency in our state or for that matter in our region, issues this life-saving drug to their officers or deputies, even though it's safe, easy to use, and relatively inexpensive. For example, we've had a great relationship with the health department here who's helped us get naloxone, and we've worked with other providers, so this is not a cost issue. Community members should be asking, why is that the case? And insisting that this change. If the overdose involved a member of your family or a friend, you would want the deputies or the officers who respond to have this critical resource. And we've used this very successfully so far in our department, so there is absolutely no reason why this drug shouldn't be carried by every law enforcement agency. It's nonsense, the idea that it's perishable or that it's hard to train people on it or that, it's difficult to use. No, this is a lifesaver. So I want to make it clear how important this opioid reversal drug naloxone is, and also that it's now available commercially, in other words, over the counter, for any member of the public to purchase at a local drugstore. You can go to any drugstore and get this. So I encourage anyone with a friend or a loved one who's battling addiction to purchase this drug and to keep it with them at all times. Now, I want to tell you about another key part of our life-saving efforts to help individuals who are battling drug addiction. This initiative recognizes what more and more research tells us. Incarcerating people who possess or use small amounts of illegal drugs is ineffective and does nothing to address their underlying challenges with addiction. In fact, these individuals, basically, they cycle in and out of jail. When they come out of incarceration, they often quickly resort to committing property crimes again, which we see happen over and over in our community, such as burglaries or car break-ins. They do this in order to get anything that they can sell or pawn for quick cash, and then they use the cash to buy the drugs that they're addicted to. You get the cycle. They get arrested again, whether it's for a property crime or whether it's for possession of the drugs. They go to jail, they get out again, and so the cycle continues. People do not get addiction issues addressed in jail, no matter how good the jail might be. So the initiative that we are working on is known as deflection. This is a new term to a lot of folks, but what it means is that our officers now have the discretion to direct someone immediately into treatment rather than taking them to jail for possession or use of small amounts of drugs, including opioids. And so I'm going to ask Assistant Chief Kevin Hall, who's really been a pioneer in our department in terms of working on this initiative and who is implementing this program in collaboration with Pima County's Office of Criminal Justice Reform, to come up and speak to you a little bit more about what we're doing. Kevin?
Good morning. As the chief said, my name is Kevin Hall, and I've been involved in the deflection program. Real briefly, we just rolled it out July 1. The program has been going for about 124 days now, and as of this morning, we have deflected 101 individuals from the criminal justice system into treatment as the program was designed. This is not only about treatment of these folks, but it's about saving lives. The whole impetus of starting this program was recognizing that this is an issue in the community that has caused numerous deaths. Just last year, the Office of the Medical Examiner in their annual report pointed out that over 200 people died of an opioid overdose in our county. This is a problem that knows no social boundaries, economic boundaries, ethnic or racial boundaries. It affects all portions of our community. The deflection program is designed to circumvent what the chief outlined as this cycle of incarceration, being released, engaging once again in the misuse of drugs, low-level property crime or narcotics, paraphernalia type crimes, and then cycling back into jail. One of the things a lot of people don't understand, there is no treatment in jail. There is no medically assisted treatment in jail for opioid use. That puts people at a greater danger once they are incarcerated the amount of time that they're in jail. Once they come out, they're at a greater danger of a fatal overdose because of the way the drug works in their body. So we continue to move forward with this. There are several different factors in our deflection program. The newest one we're rolling out is what we call active outreach. We have members of our mental health support team who will team with our peer navigators. The peer navigators are grant funded. They're embedded with our MISS team in the Tucson Police Department, and they will go out and look for folks in parks, anywhere that they can find them, and attempt to engage them in services. These include folks that we've already deflected who may have disengaged from services at the Kodak 24/7 Clinic of Excellence. They will go out and essentially stalk these folks and continue to try and re-engage them in services. If for whatever reason they can't and they decline the services, it's completely voluntary. At the very least, the officers will then issue them the naloxone, teach them how to use it. It takes about 5 minutes. It's very simple, and hopefully build trust and rapport. And like I said, we will keep going back and keep going back and keep going back. This is all about saving their lives. Another portion of the program is what we call self-referral. Anybody who feels like they need treatment for this disease, and it is a disease, can walk into any substation or this headquarters and ask for assistance, and we will facilitate getting them to treatment at one of the treatment centers, primarily the Kodak 24/7 Clinic of Excellence. At the same time, what we call social referral. They can walk up to any officer out on the street who is engaged in their normal course of duties and ask for help. We will do the exact same thing. We will facilitate getting them to treatment. This is about saving lives. The whole program is about saving lives, and that's where we're going with this. MAT treatment doesn't fix all addiction issues. One of the big issues that we have right now is methamphetamine. In fact, generally when we see opioids, we also see methamphetamines, polydrug use. But the treatment centers that we are utilizing will also address through non-medical strategies the methamphetamine use as well. Same thing with alcoholism, which is one of the most dangerous drugs to withdraw from is alcohol, and we also have facilities who will treat alcoholism as well. All of these addiction issues are all considered a disease. We look at them as a disease. Science has shown that it's a disease, and this is the direction that we want to take to basically become community problem solvers as a police department.
Thank you very much, Chief. And I would only add one thing, which is this deflection program is something that officers have the discretion to use. It is not mandatory in every situation. They have the discretion to use this with individuals who are genuinely cooperative and interested in receiving treatment. So it is not something that we can necessarily use with everyone, but it is something that we're using with more and more individuals. I should also mention that this is not something that we're doing with people who are selling or dealing or distributing drugs. We take those cases very, very seriously as criminal acts, and we are aggressively involved in prosecuting them with the cooperation of the county attorney as well as our federal partners. So again, this is about individuals who possess or use small amounts of, I guess what we could call pocket drugs of various kinds, but especially the opioids that we're seeing recently. So I'd like to now introduce TPD Lieutenant Chris Wildblood. Lieutenant Wildblood is assigned to the Counter Narcotics Alliance, which is a regional cooperative of law enforcement agencies working to address drug issues, not just here in Tucson, but throughout the Pima County region. Chris has been very active in this as well as in public education around drug issues, so he's going to explain a little bit more about what we're talking about this morning in terms of opioids.
Thank you, Chief. So I just want to start by saying it's like the Chief said earlier, it's really unfortunate that we're all here because of the death of a young person in the community. And I think it's real important that people don't lose sight of that as much as we talk about or use legal terms. That was someone's child, someone's grandson, brother, whatever it may be. And there was other people that were impacted by this as well, and that extends out to their family. So it's not just the victims we talk about, it extends out by several degrees of separation. So I just ask that people keep that in mind, that this was a pretty serious and significant incident. As far as the investigation of the incident, I will tell you the Counter Narcotics Alliance is involved in it. We're investigating it with one of our federal partners, the DEA. I asked them to come on board to assist us with it. The DEA, as far as in Tucson, Southern Arizona, and all of Arizona, is an excellent partner and a resource for us. So I just publicly would like to thank them for contributing help in this investigation as we take it forward. So it's, like I say, it's actively under investigation. I'm not going to talk about any details. I can tell you that our detectives involved are headed in the right direction on it. So I think that's a positive thing. In preparation for these types of investigations, the Counter Narcotics Alliance, we started sending out agents and detectives to some training nationally on specifically with drug death overdoses. It's kind of a specialized thing in this part of the country. We've needed to up our game and get a little more education, so we've been taking steps on behalf of Tucson, Pima County, and all the members of the Counter Narcotics Alliance to head that direction. That's a resource available to all of our partners. So the other thing I want to talk about, the chief mentioned naloxone. That's the name brand NARCAN. That's the one that our patrol officers use. It's in the nasal spray. I think you have a example over there you can take pictures of. But the importance of that, I mean, I can't really overstate it enough. It really is a life-saving drug. It's very important that our officers carry it. The agents at CNA all carry it as well to deploy it in these types of incidents. It saves lives. It's not just exclusive to law enforcement to use. Like the chief said, you can go to a pharmacy anywhere and go up to a pharmacist, tell them, hey, I have a loved one, or I have an issue, or whatever it is, and they should sell it to you right over the counter. Sometimes, though, what I've run into is that some of the pharmacies aren't totally up to speed on what the state law is now as far as giving out naloxone. So through the Arizona Department of Health Services, there's actually a standing order that's available on their website that any member of the public can go to, print it off, take it into a pharmacy, give it to the pharmacist, and it basically serves as the prescription that they can obtain the drug. It comes in several forms, both through syringe, the generic version, naloxone, Narcan. There's another one that's an auto-injector. It's available as well. It's considerably more costly than these other two forms. So that's one way people can go in and they can purchase it that way. Another way, and another really involved community partner that provides both training in it, is Sonoran Prevention Works. We've worked with them over the past year and a half on these issues. They provide free training, and they will actually give out these kits with one of the forms of naloxone in an effort to help reduce the deaths and saves lives as well. So that's available to people if they go to their website. They're very proactive, very friendly. They have other harm reduction type tips that they can educate the public with and help anyone that wants help on it. They're a great partner as far as that goes. So one of the other things on the naloxone, what we're finding is because of the powerful synthetics, in the old days, like a regular heroin overdose, so to speak, would just be like 1 4 milligram dosage. What we're finding with these synthetics is that they're so powerful and they're binding to so many of the mu receptors in the body that it's taken multiple dosages of the drug to actually disrupt it, to flip it off the receptor and then block it from the overdose effects of the drug, and to start breathing again and let the body system start catching up. I'd actually recommend that instead of just getting one dose, that you carry multiple dosages of it for that exact reason, because one's just not going to be enough when we're going up against these synthetics. And they keep producing more powerful ones in the labs where they're cranking this stuff out. So, and it's going to continue to kill people until we raise the awareness, until we get more naloxone out there, and people realize it's okay, this is a disease, this is an epidemic, we got to reduce the stigma surrounding it. And this is really a good start, is the education, naloxone, and just raising the awareness. So the last thing I kind of want to touch on is if someone does have a pain issue, or they do have a substance use disorder, an opioid use disorder, the Counter Narcotics Tucson Police Department, we are encouraging people to go out and seek treatment. There's a lot of treatment available in the community, as Chief Hall pointed out. It's available. You can walk right in, like he said, to the Kodak Center of Excellence. It's one of the model centers in the entire nation for setting up this type of treatment. So we're real lucky that we have it here in Tucson and in Pima County. I'd encourage people to use it. If people need to talk to their doctors, their physicians about their pain management issues, or other qualified professionals when it comes to issues such as trauma or childhood trauma. There's a big link with childhood trauma and later health consequences in life, one of them being substance use disorder or opioid use disorder. So talk to people, get that type of therapy, start getting on the right track to put your life back together. There's help out there, like I say, don't be afraid to ask for it. A lot of people will help with that. If you do have to take these types of prescription drugs, I know we're talking about probably counterfeit drugs or pharmaceutical type drugs. It's important to know that if you are prescribed those drugs, take them exactly as you're prescribed. Don't share them with people. Don't take more than you're supposed to. And only get them from a licensed pharmacist in a licensed pharmacy here in the United States of America. Don't go down into other countries that are nearby and picking up your drugs down there to save a few bucks. Number one, it's illegal to do that, but number two, you don't know what you're going to get. You can't necessarily trust the source like you can from a United States pharmacy here in the U.S. So do that, get help. You know, you can overcome this, you can get better, you can get back to having a good, productive life. There's a lot of hope and a lot of treatment out there, and we just really want to continue to convey that message. So thank you, Chief.
Thank you very much, Lieutenant. And I should mention, just as a follow-up to that, that it's very few of us that don't have one version or another of various painkillers that are often opioids or narcotics in our homes. But here's the thing, especially if there are other people in and out of your house, if you have children, whatever the case might be, you really need to properly dispose of these drugs after you complete your use of them. I know a lot of people think, well, I'll keep it around for next time I'm not feeling well, but that's really a bad strategy. So there are right and wrong ways to get rid of these drugs. I know a lot of folks think conventional wisdom just involves perhaps flushing them down the toilet. That's extremely hazardous to the environment and our groundwater. So what we are encouraging you to do is bring the drugs into any of our TPD locations, any of our substations, or in fact our main headquarters here on Stone. We have a bin, a secure bin that they can be placed in. We actually prefer that you bring them in the actual container that they were in. If you want to marker off your name, we don't care. Frankly, we're not going to pay any attention to that anyway. But we prefer that you do that as opposed to taking all your bins, throw all your drugs, throw them into a plastic bag, and then just bring the bag in. Plus, that presents, I suppose, some minor concerns you might have about getting pulled over. Probably not the best plan for transporting. So just bring the drugs in anytime our stations are open, and that's a safe way to dispose of them. So we're going to wrap this up with one more speaker, and he's, I think, an important part of this equation because, as Lieutenant Wildblood said, there is hope after addiction. There is treatment. People can go on to live not only better, but actually very productive and successful lives. And so, you know, we've heard about a terrible tragedy, a death involving a young person, but we actually want to end this presentation with some comments from Zach Stout. Zach is an engagement. A little bit about his story and his recovery. Zach?
Thank you. First, I would just like to say that my heart goes out to Mr. Chavez's family. And with the rise of the opioid crisis and this epidemic, unfortunately, this continues to be a pattern that we see all over the nation. I think that it highlights the importance of having naloxone with every law enforcement agency. The fact that it can save lives is huge. And with my own personal lived experience, unfortunately, I've known many people who have overdosed, some of which were no longer with us, and naloxone may have been able to save them, and that's important. And I think that we need to hold hope that every law enforcement agency has this readily available. Law enforcement officers already have, they're trained in AEDs, CPR. This is another tool that can help save a life, and it's quick, it's easy, and it's something that we need to focus on. And I commend TPD for having this, and as well as the deflection program. It's important to change the stigma, the negative stigma that is on addiction. If addiction is a disease, why are we incarcerating people for suffering from this illness? Instead, we need to deflect them from jails and from incarceration and send them to treatment where they can receive help and receive a better life. And I'm here to show and be an example of family members and friends and people who are suffering from addiction that recovery is real, recovery is possible, it is something that you can achieve. I myself was in a situation where I suffered from opioid use and heroin addiction, and I received rehabilitation and recovery, and now I'm a triple major at the University of Arizona with a 4.0 GPA in the Honors College on the Dean's List with distinction. I was admitted into Columbia University. I work with Pima County in the Criminal Justice Reform Unit as an engagement specialist. So family members, if you have individuals or loved ones who are suffering, hold out hope. If you yourself are suffering, hold out hope, because you can turn your life around. It is real and it is possible. Thank you.
Right on, Zach. Thank you very much for that. I'm not sure we'll be able to necessarily answer all your questions, but I've got some great people here who can assist me with that. So maybe both Kevin, you, and Lieutenant want to come up here, and we can, if there's, we're limited, as I said, in terms of this investigation, but if there are other questions, we also have Terrence Chung here from who runs the Office of Criminal Justice Program Reform at Pima County. They recently received a pretty significant grant from SAMHSA, about $1.5 million, that is helping to fund a number of different efforts, particularly this deflection program. So we have the right people in the room. We'll take your questions.
When you talk about the ineffectiveness of jail as a way to break the cycle of addiction, does the time in jail break the physical nature of the addiction, but there's still a psychological aspect that persists, or is there still a physical aspect that stays with you?
So let me start, and then I'm going to hand it off to Kevin on this. Let me just give an example that one of our service providers gave me the other day that really brought it home. He said, you know, people go to jail or even to prison, and they're smokers, and before they go in, they're smoking, and then when they're in jail or prison, they're not able to smoke. Sometimes it's a matter of months, sometimes even a matter of years. And he said his experience over and over when these folks get out is what's the very first thing that they want? A cigarette. And we're talking, that's just cigarettes, not to imply that that addiction isn't tough enough, but that's just cigarettes. I think there's evidence, and maybe you want to discuss it a little bit, that this is in fact a really serious addiction that isn't solved by just absence or separation from the drug. So, Kevin, you want to step around to the microphone?
Abstinence is not treatment, and in fact, it can exacerbate the disease itself. It is truly a disease. I mean, science has established that, continues to establish that, and if they simply go into jail and there is no treatment, there is no therapy, there are no life skills coaching going on, they're going to have the same disease when they get out. It's just going to be untreated and worse.
Question on the diversion program. Cochise County is running a similar program county-wide. If someone walks up to an officer or into a station and asks for help, they're not charged for any of the drugs they have on them, any of the paraphernalia they have on them. Is that true with TPD's diversion program?
That is absolutely true. So it is our hope that they would get rid of that before they walked up. But even if they have those low-level, what we call pocket drugs, small amounts of drugs, paraphernalia, their rig that they shoot up with, any of that stuff, then that goes into evidence to be destroyed, and no case is pursued beyond that. They go to treatment.
You had, how many, 7 people here
The chief
Come
said
around
8.
to the microphone.
Well, there was 8 total involved, including the people that were in the car that flagged down the officers, so.
So do we have some extra bad stuff floating around the streets of Tucson? Is this what you would normally see, or is there something going on here that goes beyond the fact that you had 8 people?
You know, that's an excellent question, Bud, and that's certainly what we're trying to get at in our investigation, that if there is a batch of these hot pills out there that are more potent, stronger, they're above the lethal threshold for whatever analog or drug it is in there, that, yeah, we want to try to track that down and stop that to prevent more deaths from occurring. So that's absolutely one of our goals in this.
Do you suspect that? Do you suspect that?
You know, it's hard to tell. I mean, you got to wait till you get all the facts in and look at all the circumstances surrounding it. There's a lot of issues that could play into it. I'm just not going to speculate on what it might be, but really we got to, I just am afraid we're going to have an epidemic if we can't track them down.
One of the things is that worst case scenario, obviously without the naloxone, without NARCAN, this could have been a whole hell of a lot worse than it was. What's worst case scenario without this and without the change in attitude? I mean, years ago it was like, well, okay, fine, that attitude doesn't seem to be prevalent here anymore. So worst case scenario, what would have happened 5 years ago, 10 years ago without the naloxone and without the change of attitude?
Well, I think if our officers didn't have it, certainly we could be talking about 4 fatalities at least, possibly 5, maybe 6. I mean, it just depends on how many people took it. But, you know, the way it was in the past before the officers carried it, we were dependent upon paramedics, medical response, TFD, and they would come and they would show up and they would administer the drug. But when you're talking about reversing these overdoses, and especially with these fast-acting drugs that we're encountering now, you know, time is critical. Like you talk about the golden hour in a stroke or a heart attack, it's the same concept with these drug overdoses, that the quicker we can get in there, the quicker we can administer those things, you know, the better chance or likelihood of survival. So it's very important that officers are carrying this, and it's starting to pay off.
Is there a typical path for these drugs? Are they made in a foreign country, smuggled here, made here?
As far as like the counterfeit type pills?
Yes, how
or
do they make it to the users?
through the traditional drug smuggling routes and cartels and various dealers along the way, you know, the supply chain of the drugs into the country. There's chemicals, when we're talking about fentanyl and the analogs, I think there's pretty strong indications that that's coming out of labs in China, and then it's shipped over into Mexico, Canada. Some is direct shipped right into the United States, and then, you know, they're putting it all together with whatever, like fillers and binders and chemicals that they're pressing into these pills, using pill presses to crank them out with the little dyes to make them look like pharmaceutical products in a lot of the cases. The M30s, we've talked extensively about those over the last year, the little blue pills that are imprinted M on one side, 30 on another. All indications are those are coming up from Mexico. So it's the same as any of the other drugs that are flown into the country.
Chief, I have to ask you, the $1.5 million grant that is going to be shared by you and others in Pima County. I've talked to Clarence about it in the past. Your deflection program, is that one of the reasons why you think the DHS, the Department of Health and Human Services, gave you this grant? Is because you were moving this thing forward? And if that is the case, how will that be used in order to move this even further forward?
I think it definitely is a factor. SAMHSA recognizes, in other words, the feds in this case here that have this responsibility for health and services, recognize that there's some very creative and important work that's being done in Pima County. We're really lucky to have the partnership we do with, you know, the County Administrator's Office and the work on criminal justice reform that's being done out of that office. But we also have very strong partnerships with the County Public Health Department. Dr. Garcia and his team are fully on board working with us on all of these initiatives. And, you know, I've got to say, our fire department, Tucson Fire Department, is an excellent partner. We are working very closely with the DEA here. There's really a lot of, I think, outstanding work that's being done, and I think that's one of the reasons why we're seen as a good recipient of a grant of this nature. $1.5 million sounds like a big grant, and it is, but the problem is also really significant, and so we hope that at least with this grant, we can start to have an even greater impact on the problem.
The deflection program, obviously, there's a line that you have to draw. Pima County is even sometimes a felony. They won't even charge you, won't even appear on your record. Do you use the same standard that Pima County uses as far as whether or not you're going to charge, whether you're going to take somebody in? Does it include domestic violence? Where do you draw the line in the deflection program?
Well, so this has nothing to do with domestic violence. This is entirely about possession or use of small amounts of pocket drugs. Again, it is a discretionary decision that the officer makes in the field. Not every individual they encounter with drugs is necessarily the right or willing candidate for treatment, but if they are open to treatment, we want to work with them. Sometimes people say, well, you know, we don't get it. What happens if they really aren't serious about treatment? If they go in and they fail, you know, they're going to be right back out on the streets. And my answer to that is, well, isn't that what's happening right now with our jail approach, except over and over and over again? We know that treatment may not initially be something that everyone responds to, but people, you know, if we can get people into programs and services where there really is a connection, there's a better chance that they really can make a recovery and then go on not just to avoid being in jail. Of course, we all want that for, you know, jail costs a lot of money. People generally don't get better in jail. They're generally associating with people who are not going to turn them into model citizens when they get out. So, but it's not just about that. It's about helping people really go on to live productive lives in the community, to become taxpayers, to become service providers. This is really our longer and our bigger goal. So this is purely about pocket and, you know, small amounts of drugs. It's not about anything else. We're working with the county attorney office on this. They understand that we're doing this, but this is a decision. Officers are constantly using their discretion in the field about making arrests or taking a different course of action. And we want to give them more tools to have available. This deflection program is an example of one of those tools. All right. Oh, I'm sorry.
What's the cutoff for using that discretion?
Do you want to speak to that?
Sure. Are you talking about the amount of drugs or the crime type?
The amount of drugs.
The amount of drugs? What we're considering pocket drugs or what we consider personal use drugs, those are criteria based on the individual drugs, but generally it's what they can use in one or two times or doses. And that can be anywhere from a gram or less of heroin, a gram or less of methamphetamines, to include the paraphernalia that goes along with it. Once again, though, it's discretionary, and it depends on the conversation and the training that we provided to all of the patrol officers throughout our patrol division. Is they're going to have to dig a little bit deeper and see if this person is ready to engage in treatment, is willing to go through. Because quite frankly, part of opioid use treatment is they call it induction, but they go through a small amount of withdrawal before they're given the treatment. They have to do that to know where they're at, their levels are at in their body. So they have to be willing to go through a little bit of pain to get better. And those are some of the things that the officer has to determine as they're talking to these folks and figuring out whether this particular person at this particular time is right for this particular program.
And just to clarify, no one should say someone sees an overdose in progress in front of them. No one should fear, whoa, I'm going to be in trouble for being associated with this if I go to get them out.
Exactly. And back to Bud's point is obviously multiple deaths at one scene is the worst case scenario, but in the past, people there at the scene, including the survivors of an overdose, would also be arrested, where that's not occurring right now, and we hope to not occur again.
And if I could, I will just end it with this. People ask, well, how can I get more information about what's happening with opioids? I have questions about what resources are available. I'd just like more information so I can talk about this with my family. We're certainly encouraging people to talk about with their children. Arizona Department of Health Services has an excellent website that deals specifically with opioids. Unfortunately, it's a super long URL. I'm not quite sure why that has to be so difficult. So here's my suggestion. Go to Google, type in Arizona opioid information in Google. The first choice that comes up is this excellent website from the Arizona Department of Health that covers a lot of territory, provides a lot of resources, very easy to find, much harder to try to give you the whole URL for the website. So again, just Arizona opioid information, and I think it's like one of the first or second things that comes up from the Department of Public Health. We really appreciate you being here this morning. This shows you have concern for the community as well. We'll be around if you have additional questions. But again, thank you very much for coming. Nice job. Terrific. Thank you very much. Really did a great job.